aging is associated with lots of signs on our face that we start to see more and more as time goes by. That being most commonly wrinkles on the face. So there are different ways that we could treat these wrinkles, and one of them being a chemical called Botox, Dysport, or Xeomin. So these three chemicals are injected into these facial muscles. These muscles are responsible for the wrinkles that we see on the face. So what these chemicals do is they weaken the muscles and really soften out that look, such as the wrinkles between the brows or up on the forehead or in the crow's feet area. Now the wrinkles that are seen at rest around your mouth area, around the corners here, that can be addressed with something called dermal fillers. And dermal fillers are injectable as well, and they're used to fill in the volume. So it's really best when used in combination, Botox, Xeomin, Dysport, and the dermal fillers. And there are many different dermal fillers on the market today. Many of them are used in the same area around the mouth, and they last different amounts of time. So some of them last 6 months, some of them last up to 12 months. It just really depends on which kind you're using. Additional signs of aging include sunspots and fine vessels around the face. So these can be addressed with laser resurfacing and light therapies. Laser resurfacing, what it does is it creates tiny little microscopic holes in the skin and stimulates collagen production to help smooth out these fine wrinkles and sunspots. Light therapy, on the other hand, absorbs into pigment and the redness in vessels and helps to ablate those areas for a more rejuvenated look to the face. In addition to the non-surgical cosmetic enhancements that are offered at our institute, it's also very important to start on a good topical regimen, so including a nice face wash, an eye cream that'll help with the areas around the crow's feet, an antioxidant serum, definitely a sunscreen to help protect from skin cancers, and then a retinol. As well, there are certain topicals that can help address pigment too. So here at Bascom Palmer, we offer consultations for full skin care as well as the procedures that we offer. Most of my patients come in asking for ways to rejuvenate their skin and their face and their eye area. Surgically, patients will come to me wanting to address their droopy eyelids. So really two different things, it depends. The aesthetic patient, just ways to rejuvenate, but surgically, ways to fix the droopy eyelid. The eyelid, some people are surgical candidates, and so we do something called a blepharoplasty, where we remove some skin and some excess tissue from the upper or the lower lids. And some patients are not surgical candidates, in which case, if they just have a little crepiness of their lower lids, we use things like laser resurfacing or dermal fillers or one of the chemicals, Botox, Dysport, or Xeomin, to rejuvenate the eye area.